Well, good morning. This is Dr. Max Mulipe of Maximum Wellness Clinic, teaching practical ways to live a fuller, healthier life. This morning, I'm with Dr. Amy Ressler, who I'm very proud to introduce. I worked with Dr. Ressler as a camp counselor for many years at her drama and creativity camp, Frogwarts. And I got that position through the AmeriCorps, working with her back when I lived in the Midwest. And I'm so pleased to have her on this morning. Good
We
morning.
go way back. Good morning. We do go way back, don't we?
It's true. Like all the way back to the early 2000s, way back when.
Way back. All the way back.
That's right. So I just wanted to ask you a few questions about your experiences working with chiropractic and working with me in particular, just to see what you've learned and what your experience has been like. So can you tell me a bit about what your health concerns were before working with me?
At the top of the list, well, as I've been getting older, I've developed some chronic issues, and I would say that at the top of the list there was inflammation, which I must say I feel like 20 years younger since working with you because there was so much that I learned from you about the causes of inflammation.
Mm.
And so with changes to my diet and to better sleep hygiene and getting regular chiropractic care, as well as some of the excellent supplements that you recommended, um, I've been able to really turn that around. And I know when I've fallen off the path because I right away start to feel achy knees, achy hips again, and then I have to, go back to say, what am I doing that I know I'm not supposed to do? And those are all things that I learned from you.
So, you talk about inflammation in particular, and you also mentioned that you notice when you're getting off the bandwagon and you can start to feel it again. Is it easier to get back on to a healthier routine once you notice those things?
Oh, yes, absolutely. And, it primarily has to do with, I would say, the ultra processed food landscape that we are all surrounded by. In my life, I travel a lot, and I'm out working with people with kids and so on, and other faculty a lot, and so many times, if I don't plan ahead, then I end up in that landscape. It's kind of horrifying, the stuff that we feed our children, in public schools and things like that. And it's easy to not be in control and just take whatever comes, and usually that adds up. One or two little times off the wagon doesn't seem to be a big issue, but if I'm not careful and I'm really, really busy,
Mhm.
that's when it gets to be the worst.
That's something I hear a lot, and it's really remarkable when you think about how many Americans just live their lives without access to fresh food and healthy options. When all you can really afford or get is the super processed stuff. Say, particularly, I notice that at food pantries, it's almost all really processed, carby foods that will just destroy your metabolism and promote that inflammation. It's really unfortunate.
It's true.
So what made you want to try a treatment plan with me initially?
Well, I had been seeing a regular MD for a long time, obviously. I mean, we all have. And I was disappointed with the kind of the answers to my questions that I would get from my MD.
Hmm.
And it was almost always, well, here, try this drug or try this drug. And finally, I just thought there's got to be another way. And I actually found that there were some things that I ended up teaching her that was kind of a surprise. Um, I just wasn't getting any kind of. I was told that, well, that's just part of getting older,
Hmm.
you know.
Yeah.
I'm sure people say that to you a lot, but it sure didn't help me. I mean, I was looking at, another at like 25 years in the workforce, slogging away every day, waking up thinking, oh my God, oh,
Mhm.
the aches and pains, and to just swallow another pill and, go have a donut or whatever there was just something wrong. There just was something wrong. So,
I hear that kind of story all the time from my patients. So I know you're not alone in that. Um,
mhm,
but it is really wild to me. It's, you talk about that chronic inflammation is particularly affecting your joints and how much that would bother you and, make working life miserable. And it wasn't that your body had a Tylenol deficiency, right?
that's correct.
Yeah. It's like what other causes are there? Is it something you're eating? Was it an infection you were exposed to? Is it too much of a toxin load? I know growing up in the Midwest, we're surrounded by Roundup, glyphosate, and that, I mean, I think it's pretty well established now. But at the time, it was sort of a question mark about whether that had any effect on health at all. And now
Hmm,
we know that it really, really does. Um, so unless you address those things, you're just not going to get better. You'll just become reliant on Tylenol forever.
that's right. And the really scary thing is to look at the analyses and meta-analyses of not just chronic disease, but also, things like cancer in the
Yeah.
areas where glyphosates are used. And, what is your average citizen supposed to do about that? You know, we clean our water, we, try to be really picky about what we eat. But if it's everywhere and it's in the air, what can you do? I do, write to my Congress peoples all the time, trying to get some action on that. But yeah, the world is a toxic place, and so I think specifically about this most recent holiday period from like I want to say Thanksgiving on, or really Halloween on um, through the beginning of the year, New Year, and when you had a what do you call like a cleanse program
Hmm.
that you were offering with these protein shakes and some extra supplements to help boost the good stuff and to try to move out the bad stuff.
Hmm.
That was a lifesaver. That was really a lifesaver because it was like beginning of the year, and I thought, oh no, here I go again. I was going back to work again and feeling not just inflammation in my body, but also fogginess in my brain.
Hmm.
And I use my brain a lot for my work.
Yeah.
Um, and I just thought, oh, this must be it. This is it. I'm getting old. So this particular time, the what do you call it? The cleanse? Was that what you call it? A protocol of?
Yeah, like a cleanse detoxification program.
Hmm.
Basically, you're just bolstering the body's natural ability to clean out itself and, while also trying to avoid giving it more of a burden at the same time.
Yeah, that was a really good one. So whoever's watching this, I highly recommend that. That was really, really great. In fact, I need to get some more of that just because I really liked it and I got on it. Helped make me feel like I could think better. And also, I was working with a lot of people who were sick. And
Yeah.
so I was really worried about, am I gonna go down? And I never did. Now I can't just say it was because of that. I'm also like I wash my hands a lot and I, you know, try to stay away from people who are coughing right in your face.
Yeah.
But everybody around me was sick. Everybody. And I didn't get sick, so I think my immune system is good. Yes.
Wonderful. Well, and for those who don't know, Dr. Ressler did Standard Process's 21-day purification program with me, which is a whole body program to help support that detox and biotransformation of all the toxins and pesticides, heavy metals, everything that our body is burdened with that we have to clean up. That's especially hard, like you were saying, during the holiday season when everybody's eating rich, fatty foods, processed foods, lots of sugar. That just puts a tremendous burden on your digestive system and your immune system, and so it doesn't have that opportunity to clean out. Even for me, I do the cleanse at least once a year, and for the first few days, it kind of felt like I had the flu, but I knew that it was just the detox reaction. So even somebody like me, who is a nutritionist and a chiropractor and is really engaged and involved in this world, like I could feel a tremendous difference on it as well.
That's
Let's see.
interesting. You're probably really sensitive to such things at this point in your journey. Um, I think I'm maybe I'm not because I've grew up just slamming down whatever came across the table.
Fair enough. I will say that is one of the benefits that I really love about getting people on a chiropractic treatment plan is they start paying attention to their body and how it feels
Mhm.
in space and like what hurts, what doesn't, how can you move, how can you stretch, and you can see that sort of body kinesthetic awareness opening up as the treatment plan goes on, and people start to understand themselves a lot better.
Oh, that's true. I think I am very fortunate that I have where I work, they gave me a really fancy desk that I can stand up or sit down, just push a button and I can set how high it wants to be.
Mhm.
And I never really used it before. But after I started working with you and after some chiropractic adjustments and you said you told me that sitting is like one of the worst things that you can do for yourself. So I started to stand up more as I was working, and now I mostly stand throughout the day
Mhm.
and walk around a lot more. I hardly sit at all at work, and I think that's made a big difference also in my backache issue that was probably the original reason I came to see you, I think.
Absolutely. A couple points on that. Um, One, yes, sitting is the new smoking, as they say.
Mm.
I don't know if you follow Dr. Mark Hyman. He's a functional medicine doctor. I was just hearing him talk about how if you get up and do 10 like squats, just body weight squats every 45 minutes while you're working at your desk, it will help regulate your blood sugar the same as doing a walk for a half an hour.
Get back. I'm gonna start doing that. Set my alarm on my clock so that every 45 minutes I can do what, 10 squats? What do you say?
Yeah, 10 body weight squats. So, like you don't have to go that deep, but that just really brought home to me the point that, oh, you really need to get those muscles engaged to get that sugar out of your bloodstream. You know, even walking for a half hour is that's a lot of time for most people. They didn't have the opportunity to be as sedentary as we are. They were just moving all day. And
That's right.
estimates are that our grandparents moved 15 to 20 miles a day just to doing their normal chores if they were working on the farm or what have you. So there's just a lot of steady movement throughout the day. And it doesn't necessarily have to be the really intense, vigorous exercise like you go to a gym and do a HIIT training workout. I mean, that is very beneficial. But in terms of longevity, it's more about just keeping your body moving. Back a bit to treatment plans. What
Mhm.
would you say a typical treatment with me is like from your perspective?
You mean when I come to the office, what happens?
Hmm.
Well, uh, it's like the world's best experience because I've been to a lot of chiropractors over the years, and sometimes you just go in and they're like, what hurts, and like click pop done, you're done.
Hmm.
But when I have the great pleasure of coming to your office, first of all, we have a nice chat to find out exactly what's going on, which I think is um uh, something that absolutely didn't see even from my regular MD, you know. So there's that, and then you usually use this machine that does a shaky shake thing all over my body, loosen everything up, and
Sure.
that's really nice. That's one of my favorite things. So besides the chiropractic stuff on my back, um, as a very tall person, a lot of times you usually are able to get my hip to go back where it's supposed to be because I do have this chronic problem with because I drive a lot, I think. I have a one hip that tends to go out or like I end up with one leg that's longer than the other,
Mm.
which is painful over time. So you get that straightened out. Um, we also like because I use my hands, sometimes you will fix my hand. Actually, I need to make an appointment because my thumb is ouchy right now. You're one of the only chiropractors I've ever been to who is able to make that go away in a, quickly.
Mm.
Um, but also, let's see, one of my favorite treatments is the cupping thing
Yeah.
that you do. You know, I hold a lot of tension in my shoulders, especially one side. I remember when I was working on the manuscript for my book, for my most recent book, and I was just like solid, painful muscle here. And first we did cupping, and then you did something that I think you call scraping. I don't know, like you
Oh
you
yeah.
broke up that muscle with a
Adhesion
thing.
breaking.
Yeah, because it was pretty bad. It was pretty bad. And that was like painful, but it's like it felt so good.
Yeah.
That's a weird thing to say, but it was like, oh, at last I can get that
Yeah,
out.
I like to call that therapeutic pain, you know. Um,
Ah,
it hurts so good kind of thing, or you know that this
exactly.
is intense now, but it's going to feel a lot better afterwards.
That it was exactly it. I thought I was gonna end up with what do they call frozen shoulder because it
Oh,
was so
wow.
bad,
Okay.
but I didn't because you were able to break up that terrible muscle adhesion that I had developed there. We also would, and you always get my neck, so then I'm able to think better, which I think is something I look forward to all the time. But then we often talk about like what where are other kinds of issues and the what do you call it, kinesthetic or resistance thing that you do.
Oh, yeah, the muscle testing.
Muscle testing, yeah, for me, it's surprisingly accurate. You know, like you're able to tell me, like you'll say, well, this seems like you have issues with your lungs or something like that, and I'll be, oh, well, yeah, I just got over pneumonia, or you know, I had bronchitis a couple weeks ago, and so then the supplements that you recommend. Um, are are sort of specifically directed at whatever it is that I'm having an issue with.
Mhm.
And I used to have issues with my heart, and I really kind of don't anymore. You know, I have atrial fib, and I have to watch my caffeine intake, which you know you recommended, but also some of the supplements that you give me. If I run out, I can tell
Mm,
because then I get that fluttery butterfly feeling a lot more
okay.
if I run out of those supplements. So I'm on it. Yeah, and then there's one other thing I just wanted to mention,
Mhm.
which was that as I got older, I started to have increasing heartburn, and it was really just making my life miserable. So this is before I started seeing you more regularly. My MD had prescribed I think it's called omeprazole, something like that, was an
Oh,
acid
yeah.
reducer,
Hmm.
you know, which in the moment helped, but then I found that it was getting worse and worse and worse. And then when I mentioned it to you, and you said, "Oh, well, here's the thing. As you get older, your stomach doesn't produce the as much acid as it used to break stuff down, or a different, you know, it just doesn't work as efficiently. Also, you know, some other things." And so you recommended to me some supplements that I actually carry with me in my purse so that if I'm out and about doing something and then I end up, you know, having a taco or something somewhere, I can have that and I don't end up with uh, terrible heartburn all day long as I was before. But I also had then after we met about this. Then I saw like some big expose on the news that was saying that acid reducers have some really bad long-term effects for people
Oh,
that I think even like dementia is one of the things which who would have thought? And
right.
yet like you said, you know, you said, well, your gut is kind of your first place that it's like your first line of defense. And I was never used to thinking of myself as a, you know, a holistic fit being with, you know, thoughts and feelings and physical body things that are all related. I think that the MD world tends to like cut that off and be like, oh, well, here's a pill to fix that part of your body. Here's a pill to fix that part of your body, as opposed to seeing how it all works together. And I think that's probably at the one of the my favorite things about going to see Dr. Max.
Well, wonderful. I always strive to approach the treating patients from that holistic perspective because, as you said, everything is interconnected and related. As far as the omeprazole, the acid reducers go, the big issue there is because it prevents you from making acid. It also prevents you from digesting and assimilating nutrients. So
Ah,
you get all of this food moving through your digestive tract that's not really broken down. So it putrefies and goes rancid, and it produces a lot of fermentation and gas. And your body can't absorb the nutrients in there anyway because it's not broken down enough. So over time, you get all these vitamin and mineral deficiencies. So it can be pretty bad. Once we reach
Makes
middle
sense.
age, the human body produces about 50% less stomach acid. And by the time we're in our 80s, I'd say almost 90% of my patients just don't make enough stomach acid. So either having a replacement for that or having something that helps to treat heartburn in more of a natural way can be imperative to just to make sure you have optimal digestion, because that's going to affect you from the inside out and affect every part of your body, from the smallest organelles inside your cells all the way up to your greater structure.
Yeah, interesting. That makes sense now. Yeah, it's much more than just, yeah, the stomach ache. Yeah. Okay.
Well, I wanted to finish up with a couple of questions here. I know obviously you're feeling a lot better overall. What sort of changes have you noticed in your daily life now that you're kind of on this maintenance plan? And how has that impacted your ability to live your own personal mission?
Well, let's see. I the thing that I recognize the most is that when I get up in the morning, I don't have the aches and pains that I
Mm,
used to have, and that affects your whole day. I work with little bitty kids a couple times a week, early in the morning. Like I'm there by 7,
mm,
and I don't think I was I before I started to see I was at the point where I thought I just can't do this anymore. I really just can't. And so now I'm at the point where I'm teaching other people how to work with kids in the way that I do, and they're college age students, and I not only can keep up with them, I'm ahead of them most of
mm.
the time, down on the floor playing with the little ones, and telling stories and getting them to jump and stuff with me, and the college students are like, well, I don't know if I could do that. I can do this. Um, so it's made I have seen that my working life is much more enjoyable because I'm not always thinking, oh, I can hardly wait to get home. I can hardly
Mm.
wait to, like that kind of thing. Although I do take a little 20-minute, 15-minute power nap in the middle of the afternoon as I've gotten older. Um, so that's one thing that's made a big difference. And I think in general, the way that you have encouraged me to take responsibility for my own health rather than asking somebody else to, fix it with a pill or that kind of a thing. I really appreciate that you respect my intelligence enough to know that I can learn how uh, ultra processed food will kill a person over time, and some of the videos and books that you've recommended. Um, Most of the time, when you have introduced me to some of those things, it was like mind blow. How did I not know this? How did we get to the point where this is just regular everyday stuff? It's part of the common parlance, and it shouldn't be. I think one time you said something about like if a food isn't able to rot within 3 or 4 days, probably shouldn't be eating it.
Yeah.
So
It's like,
yeah,
is it,
like all
what's
the
it doing in your
preservatives
body?
and things, right? It should be able to rot. Better to eat that pear that's almost gonna be put in the compost than to eat a pear that's been, dried and processed and put in some kind of a nutrition bar or whatever. Nutrition.
Absolutely. Yeah, if you can look at a piece of fruit and not know if it's made of wax or not, you probably shouldn't eat it.
That's true.
Um, well, I just wanted to finish up by asking you to tell us a bit more about your camp, because
Mm,
I it was very transformative for me when I was younger, and it was so much fun. So tell us a bit about your summer camp.
sure, sure. So 23 years ago, now, I started a camp that was originally based on the Harry Potter books. It's called the Frogwarts School of Wizardry, Creativity and Role Play Camp. And when the books weren't even finished being written when we started, it was that long ago. When the books got really dark, we took a different direction and really looked at what is considered, like magic. We look at imagination. So it is a drama camp in that it's role play, but there's no audience, so it's not a performance theater camp. It's a drama camp like role play. And one of the things, and it is what I wrote my book about, social emotional learning through drama. Um, and the book is considered to be a primer on devised story drama, improvised story drama. So we do classes in all different kinds of creativity areas, but also we create our own improvised drama that takes place over a week with about 100 kids and 25 staff. And one of the most important aspect of the experience and the camp itself is that kids get an opportunity to practice their emotions in a safe place,
Hmm.
and specifically the emotions of anxiety and even sometimes fear, because they know they're safe and they know that they have control in this situation. Then they have the opportunity to practice that, and it's a very empowering experience. Over the many years that I've been doing this, kids who've graduated have come back and said, as you have, Dr. Max, that it was transformative experience for them, gave them an opportunity to decide how they want to respond to an outside stimulus, whether it's positive or negative. And I love it. I hope to keep doing it for a long time. And with your care, I think I will still be able to be doing it when I'm, 90.
I sure hope so. Before we sign off, I just wanted to say, again, from my experience working in your camp, well, first going as a camper and then working as a counselor there,
Mhm.
um, I didn't really understand or appreciate how having that practice to feel fear and anxiety in a safe environment really allows you to handle those things out in the real world when camp is over. Because those emotions don't feel as overwhelming. You've already had some experience with that and had that empowering feeling, like, oh, I was able to get through this, I can do that. And it wasn't until I was really a counselor there that I started to really see that in the campers, how,
Mm.
sometimes, and they're all pretending this drama that unfolds throughout the week. Sometimes, even though we all know it's a fiction we're all sharing together, the emotions are just overwhelming. And it was really remarkable to see some of those kids go from just that trembling fear to, facing their anxieties and, taking care of whatever the big bad or the drama was that year. So that was really cool.
Watch their triumph and celebrate their successes, as
Very.
I certainly celebrate your successes. I was thrilled that you opened your own clinic, and I would love to spread the word so that more people know that they should go to see Dr. Max. Will help you turn your life around. Will help you turn your health around.
Thank you. Please do. I'd love to help more people. And the next time you're in town, stop on by so I can check your thumb. Okay.
Absolutely will. Thank you.
All right. Have a great day. Thank you so much, Dr.
You too.
Ressler.
You too. Thank you.